Hey, Jason Tushman back here with Spot On Patient Acquisition, episode 42. As always, thank you very much for your time. Today we're going to go over and start a series on patient lifetime value. Huge untapped opportunity in most practices today because it's not a part of the normal strategy in a practice, and it's not a part tactically that's explained to the team within the practice in order to pull the most value out of it. So we're going to do a short 3-part series on this to hopefully help you out. First, patient lifetime value, right? Once you have a patient in, it costs you nothing to retain them except time and effort. So it, by default, lowers the expenses in the practice and raises your profit margin. So that's a huge, huge opportunity, okay? Now, we've got 4 main parts to patient lifetime value that you need to think about tactically within the practice to maximize value. The first is very obvious, right? The patient experience. Now, we talked about this in episode 41, so I recommend that you refer to that. But the patient experience is ultimately going to be driven by your conversion rate, right? If you can't convert them to a patient, there's not going to be value beyond that. So conversion rate is what's driving the patient experience. As far as mapping it and how to develop it, again, I refer back to episode 41. Patient lifecycle marketing. Okay, you need to constantly stay in front of your existing patients in a productive manner, okay? Now, productive manner is not emailing them or marketing to them about everything that you have going on in a practice. It's about marketing to them at the right time with the right message. You want to go back to episode 17 and look at our lifecycle marketing and patient retention detail there, okay? But the most important thing here is, 1, make sure you have a mapped set of messages to a consumer based on their individual relationship with you. Did they have a procedure? Did they not? What procedure did they have? What other procedures are relevant to that procedure, and what time should they be marketed to them? So you want to have that life cycle map figured out for your practice and what your business interests are. And then you got to use technology, guys. This is a ton of work. But once you have it mapped out, you use technology to automate it. You should be able to read your practice management database and send these messages out at the right place at the right time, and even make the phone calls at the right place at the right time. So have that mapped out, utilize technology. The third pillar, essentially, to a successful patient lifetime value effort is having a loyalty program. Now, the biggest challenge with loyalty programs are they're usually provided by the manufacturers. We highly recommend that you own your program, okay? You want to be able to contribute to loyalty to your patients with your own program. Because if you're using a manufacturer's program, they can take the points or the money that they spend with you and go use them somewhere else in your competitive market. So you want to create a program that you own. And we're going to do a specific episode on this, and I'll help give you more clarity on how to go about that. The fourth and obvious thing is referrals, right? You have to have a tactical and understood effort on referrals. Lifecycle marketing, right? You're going to use your lifecycle marketing map to generate referrals, okay? You also want to have events. Having in-office events is a great way to get referrals in, and then you've got to ask. You just got to be able to ask, and you got to know who that person is in your practice that should be asking and when. So look forward to talking to you more about this in the coming episodes. Patient lifetime value, it's a tactical part of your practice. It's something that you need to understand how to do, and it'll help generate a lot more value in the practice. Look forward to seeing you next time.